they're being treated the same. That's what needs to change.
The same doctor, nurse, or other healthcare worker who steals drugs and gets high on the job can get the crime removed from their record in Tennessee.
Our community watchdogs reporting on drug-addicted medical professionals has already resulted in one new state law, and now, prompted by Nate Morabito's questions, state attorneys are researching other possible change.
We trust medical professionals with our health to the point life and death often hangs in the balance. That's why a Washington County prosecutor thinks we should hold them to a higher standard when they violate that trust and, more importantly, the law. Our investigation found when those healthcare workers steal drugs, they have the same rights to get their crimes expunged as a person who forges a prescription or a patient who visits multiple doctors hoping to score prescriptions.
I am truly sorry for what I did.
By all accounts, Nikki Willis is the gold standard of recovery.
I don't want to downplay what I did because it was horrible.
The nurse accepted full responsibility for stealing and then injecting drugs, diverting narcotics for more than a year while working at Johnson City Medical Center, according to her license suspension order. She also pleaded guilty to obtaining narcotics by fraud, and last month bared her soul at her sentencing hearing.
I'm just happy today to be alive. I'm happy to be sober, and I'm happy that I could be the person I am today because of this.
In letters, more than a dozen supporters urged the judge to give her a second chance. State law allows that in cases like this one. Judge Lisa Rice sentenced Willis to supervised probation, requiring her to participate in complete treatment programs and pass random drug screens. Diversion offers another benefit for people looking for second chances. It allows offenders who qualify to wipe their criminal slates clean, eliminating red flags from their record.
Okay, I found another one.
Prosecutor Erin McArdle wants that to end.
The people in this position should have more accountability, and it should stay on the record so that not only the public knows, but future employers.
She says it's especially concerning when you consider what our original investigation found. Drug-addicted medical workers who were able to find new jobs despite prior problems. Something McArdle says has continued in the months after our original report.
Certainly, the healthcare provider should be held to a higher standard.
Senator Rusty Crowe led the effort to change state law following our investigation.
Our attorneys in Nashville are looking at it already, and we'll see which direction we can go.
The Senate Health and Welfare Committee chairman says he understands where McArdle is coming from and has requested further study as a result.
When you have that, I think judicial diversion is probably not proper. I think we should distinguish between the two.
Back in court, the prosecutor fought diversion in Willis's case and promised to do the same in every one after.
There's nothing on their criminal record, then the person could be put in that position of trust again.
Willis made a commitment too. In a letter to the judge, her husband said she planned to never work around drugs again.
I accept full responsibility for what I've done.
In the end, Judge Rice ruled as long as she stays out of trouble, the court will expunge this crime from her record at the end of 2019. Nate Morabito, News Channel 11, in your corner.
Now, Sullivan County Deputy District Attorney Gene Perrin told us that he does not always oppose diversion in these kinds of cases. Instead, he takes them, he says, on a case-by-case basis.
Willis, through her attorney, declined an interview for this story. Her nursing license is on probation for at least 3 years while she receives treatment. That's according to state records.